morning, everyone. My name is James Powell. I'm a senior consultant with Cenegenics, and today I'm here with Dr. Earl I, Cenegenics physician partner. Earl, today we're here to talk about some of the most frequently asked questions that our patients have asked over the years. So if you're watching this video, I'm sure you've at least made an inquiry into our medical practice. Maybe you have not spoken to Dr. I yet, or one of the staff members, or maybe you have, and you probably still have questions. So I think we would like to try to answer the ones that we hear all the time, and that will probably help you out. But above that, everyone, please give us a call. We do want to speak with you. We're here anytime. You have been provided a phone number, and we always welcome your live call. So that way, if you have any more questions, we can answer any question you have. So Dr. I want to go through a few of the common questions that I hear all the time over the years from people who may be looking at this as a program or already a patient. Some of their friends also have these same common questions. The first one would be, how soon can I feel the results? And give me an idea of the typical results I can feel from this program.
James, the answer is a little different for men and women. For our men, we see results typically within 3 weeks. We see energy improve. We see a beginning of loss of the padding and fat around the middle. We see muscle starting to develop. We see strength begin to increase. We see libido and sex drive perking up. Sense of well-being comes back. Now, in women, we see those type of results. We see them a little bit further. It may take a month or two for them to really get kind of what they're looking for, but they begin to notice the energy is coming up. The body begins to tone and firm up a little bit. Some of those problem fat areas begin to melt. We see mood and kind of calmness. A lot of women describe hormone imbalance as being anxiety, kind of worry, just can't put their finger on it. That restores the mood back, the calmness back. And we also see libido perk up. Again, takes a little bit longer. Skin and hair appearance improves. They really typically are very delighted in the improvement of the skin. So
absolutely.
Those are more the common. I mean, there's others, but those are the common.
Sure. And I could really sum all that up into looking better and feeling better. I think that's probably the simplest way to characterize that, everyone. Look and feel like you did in your 20s. As a male being on the program, literally within a few days, I could feel a difference. And I'm really back at the same body composition as I was in my mid-20s. And as we're taping this today, I'm almost 52. And I really love feeling and looking like I did in my mid-20s. So guys, if you're watching this, very quickly you'll see results. Within a few days you'll feel better. If you work out at all, you'll definitely get better results. You'll trim up that belly fat, will shred away. You'll get more lean tone. If you're actually doing weight training and all that, you'll definitely build lean muscle rather quickly. For many of you guys, you haven't built lean muscle in probably 20 years, but you now will build lean muscle again. Sex drive, even sexual quality, guys, something you may not talk a lot about, probably don't talk about at all with your colleagues and friends, maybe not even your family doctor, but the quality of your erections, your stamina, all that, major improvements, everyone. Energy level. It's amazing how you wake up every day refreshed for a change. And I work 60 hours a week. I'm never tired. I mean, I could just go on and on, but it's a pretty amazing results. When our female patients, how they feel is just I just can't describe it. Women, you're more complex hormonally. You have multiple hormones involved, certainly menopause, a lot of mood swings, libido, energy. We hear that all the time. That's why they come in our program. And to have that restored in a fairly short period of time, she said women may take a little bit longer than 3 or 4 days like us guys do, but amazing results. A couple of months, you'll be a completely different person. In fact, most of the females will tell us, including, I'll say this about my girlfriend on the program, looks years younger. It took years out of her appearance. The skin quality is amazing. I knew from being on the program, she would have the body composition changes. That trim, tone, fit look. She looks like a 21-year-old in a pair of jeans. If I see her in a pair of jeans, I'm telling you, it's pretty dramatic, everyone. So definitely some of the most common changes and results we see on the program. Second question that comes to mind is, I hear this one, a lot of different versions of this. My family doc, or for women a lot of times, my gynecologist says, my hormones are normal, but I just don't look and feel like the way I want to. So what would you do differently?
Well, first of all, James, let's talk about medical normal. Medical normal has a range of what they call normal that's just incredibly huge. We don't do normal, we do optimal. In other words, why in the world would you want to be in the quote normal range? Because we know what happens in the normal range. If you want to get old, if you want to have all those problems progress, then be in the normal range. If you want to be in the optimal range, then we need to bring you in and re-optimize. We look at 10 hormones. Virtually everybody, now men, less hormones in terms of major manipulation than women, women more. But having said that, all of them get balanced, all 10 back in the optimal range. Therefore, the quote normal now becomes, I feel great, I'm looking good, I get all the benefits we talked about.
Absolutely. You know, one thing I heard a long time ago at Cenegenics, I've never forgotten this, to describe what you're talking about with normal versus optimal. It's a very simplistic way to look at it, but it's actually quite accurate. It's school grades. Passing, you either pass or fail. Well, everyone, you can pass at a D.
Right.
D, C, B, or A. I think we can all agree there's a big difference between a D and an A. And with my health, I would consider my own health. I was very proactive before this program. I was eating very well. I exercised on a regular basis, took supplements, vitamins, all that from GNC, wherever I could find it at. And I would consider my health, at that time I was 47, a lot better than average. I'll call it a C plus maybe a B minus at best. Well, everyone, I don't want to be a C plus at anything I do in life. I want to be an A plus. And that's what our patients want to be. They want to be an A plus.
Right.
If you're a male or female watching this, evaluate how you look and feel now and compare it back to your heyday back in your mid-20s. Are you still an A plus? And of course, if the answer is not, then you need this program because that's what this program does for sure. Next question. I hear this sometimes come up, or a variation of this, about their typical physicals and things like that. We do a lot more blood work. You alluded to some just a moment ago. Sometimes I'm asked, can I just use the information or the blood work I had on my physical?
James, the simple answer is no. Very simply, it just is not the quality. It's not the information we need to make decisions. We make decisions individually for each patient. Now, we don't have a cookie cutter program. I know you go to your regular doctor, and you know it's gotten to the point where he's got 5 minutes. There's 3 outcomes. 1, here's a pill. Number 2, sorry, you're getting old, can't do anything. Or 3, go see the surgeon. And that virtually is the outcomes. And the quality of the physicals and the blood work is designed to fit that. We're going to develop an individual program for these patients. We're going to actually have a customized built to their physiology, their biochemistry, their outcomes, their goals. We need a lot more data. So unfortunately, the answer is no. I can't use it.
Absolutely.
I'll look at it. But I can't use it.
By the way, this is not a question on here, but I just kind of thought about that in the last few minutes here. The average visit out there, think about whether you're a male or female patient, the last time you saw your physician. How long did that visit go? 5 minutes, 6 minutes, 3 minutes? Probably around that time. The average time that our physician will spend with you on that elite health evaluation is probably about 2 hours. 2 hours. You've never spent not only the time, but the quality of time ever in your lifetime. Maybe unless you were asleep in surgery. Maybe you were intubated. But in awake time, no. Very, very much quality time. It's invaluable. In fact, also on that same note, Dr. I cannot tell you how valuable it is to me. If I need anything at all, I text my doctor. How easy is that? I text him or his office, and they do it. If I'm flying or I need something on the spur of the moment, everyone, I don't know how to put that in a monetary worth, but I know it's super important to me to have not only him, to have my own personal nutritionist at my disposal, to have my own exercise physiologist. I know a lot about nutrition and exercise, but to have that expert at my disposal, that is invaluable. I would have to be on a professional football team to even get anywhere close to that, and spend hundreds of thousands of dollars a year like some professional athletes spend to prepare their foods and help them work out and all that. So it's just amazing. But anyway, I couldn't help saying that because I think it's important for everyone to realize that in this program. The next question, Dr. I always kind of laugh when I see this one because I know what I've tried in the past. Eating well, doing exercise and P90X and insanities and different machines and weights and all that. Pills, I've done it all. And so have most of our patients. So if you're watching this today and you feel like you've done things in the past, proactively, exercise, nutrition, this question always comes to my mind. Isn't eating healthy and exercising regularly, isn't that enough?
Unfortunately, James, it's not. Here's the situation that we're into. If just simple exercise and nutrition were doing the job, certainly we'd have a lot of many older guys running around in perfect health. And you just don't see that. Why? Because exercise and nutrition when you're younger works. Why does it work? Because you have the hormone milieu of a younger person that allows it to work. When you get older and the hormone imbalances occur, you start after age 30, they start dropping. You don't have basically a situation again. It's like trying to play football in a stadium with the lights turned off. I mean, you've got to have the whole experience. You got to have the field, you got to have the crowd, the stands, the lights to make it work. Because of that, they don't get the muscle. They don't get the reduction in risk for heart and cancer and stroke and diabetes and Alzheimer's. They don't get the improvement in sense of well-being and sleep and sex drive and all the things that you're looking for. So I wish I could say it did work. Golly knows it would be so much better if that were all it took, but it takes much more than that. So we need to add all the components of the program: exercise, nutrition, hormone balancing, supplements that are nutraceutical grade. We balance out the metabolics. We talk about stress management because that causes cortisol to go down, which is healthy. And last of all, we want them to sleep.
Absolutely. And there's nothing more frustrating. If you're watching this and you know what I'm talking about, there's nothing more frustrating than trying to make changes in your lifestyle, eating a little bit better, trying to do some level of exercise, and you just realize it's not working at all. You're going backwards. You're not losing fat. You may be losing muscle tone. The fat areas for males and females stay there. They actually get worse, even though you've done some changes in your lifestyle. You don't feel good. You feel worse every year. You're fighting a losing battle. So everyone, unfortunately, just doing that alone is not enough at a certain age. Next question is the program really good for me if I don't have a lot of time to exercise?
Yes, the long and the short of it is because of all the components of the program, because we address all those multiple issues, we kind of recreate the situation in your 20s and 30s. Now, I want you to think back about that. Sure, you exercise, but if for whatever reason you hit a stretch where you didn't have to do that, you didn't lose all the benefits like you do in your 40s and 50s. You don't exercise for a month or two, and even if you build a little bit of muscle, it's gone. So it helps to maintain the improvements that you work so hard to get. And going to the gym and busting your hump is not, for me, it's not much fun. Some people really enjoy it. Me, I exercise because it's healthy. So I want to maintain those gains if I can't get to it. If I can get down there 15, 20 minutes a day, I can do it. So we have programs, and we understand our people are busy people. A lot of times they're really time constrained, so we build those programs to be compact, efficient, and get the job done.
That's definitely one thing I believe you'll appreciate. Everybody has different goals. Some people want to live in a gym for 2 hours a day. Some people never want to step foot in a gym. So regardless of which category you fall into, we will individualize the program for you. I know I actually work out a little less. I've always worked out. I've been a pretty regular workout person all my life. But I do work out less now because I get better results. And my time is precious, and I'm sure yours is also. So if I can get better results in half the time, I'm all in. Some patients don't want to go into a gym at all. We create a workout program they can do from their house. Males, females, maybe you want to just watch the news and work out a little bit, get a little decent workout, 20 minutes a day, maybe 4 or 5 days a week. Whatever your time limitation would be, whatever your travel schedule would be, we will customize this for you. So no, you don't have to spend hours in the gym and treadmills in order to get results in this program. Next question, certainly a safety question comes to mind all the time. Although I will say a few years ago it came up more. Now people, I think, are a lot more well-versed on hormones, the safety of it. There's been a lot of studies the last few years, but I do get this question still. I know the question is, I know all these, the bioidentical hormones are all safe, but what does Cenegenics do to really make sure this is safe ongoing if you're on the program?
James, we stay up with the literature for one thing, because there's so much literature out there that shows that they are safe. that they do work. We choose the safest routes. Believe it or not, how you give the hormone can determine that. We choose combinations that work together to synergize, to promote safety, and we monitor. We monitor with frequent blood works. We monitor with clinical. We listen to what you say. If you're telling me, some issues that you're having, then I'm going to listen to that and say, could this be related? If so, we'll check it out. Above all, do no harm. That's our major motto.
Okay, all right, very good. And I know myself, getting blood work done several times a year, we keep the hormones exactly at the level they need to be at the optimized range.
Right.
In fact, it's not that uncommon over the years that we've been the ones by our blood work to find out a patient has another type of a problem that maybe was not picked up in their regular physical. So I know that happens some. Next question, everyone, is I'm only a few pounds over my goal weight and my cholesterol levels are good. Can I still be at risk?
Unfortunately, James, you can. In men and women, 30% of those who have absolutely normal cholesterol will have heart disease. Unfortunately, in our women, that 30% experiences a 50% sudden death rate. They're walking down the street and bang, they hit it. Men, they're out on the golf course, they draw back to hit that ball and they keel over. Remember Tim Russell, for example. There's a perfect example of a guy who went to the doctor, was evaluated, was told that he was in great shape and his blood work was normal, and he's dead 3 weeks later. So unfortunately, yes, the answer is you still are at risk.
Absolutely. Next question is, I'm hearing this a lot now. Guys, especially for you, how many times have you seen lately one of those testosterone commercials? Even a couple of years ago, you never saw one. Now I see them. You put them under your arm, you put it on your leg. They're all over the place. So the question is, especially for male patients out here, do those topical testosterones that you see on the commercials every day, do they really work for men?
Unfortunately, James, they don't. And let me kind of expand on that a minute. Men need high levels of testosterone to reach the goals that they need to have. In other words, men need 5 to 7 times higher levels than women. So when we try to put it on the skin, first of all, we can't reach a high enough level to really get the job adequately done. Therefore, we don't get the benefits we're looking for in protective. Number 2, men have an enzyme in their skin called 5-alpha reductase. I don't want to get too complex, but the long and short of it, it metabolically changes the testosterone to the wrong form. It changes it to dihydrotestosterone. Because of the dihydrotestosterone, men lose their hair, and they get a big prostate. If you want to go to the fair because you want a prize for your prostate, that's a great way to do it. Most of us don't want to do that. Now, women, on the other hand, because they have much lower levels, will be able to at least look at that as an option. Even women do better sometimes with other routes of delivery, but they don't have the enzyme in their skin. They don't develop the dihydrotestosterone because their levels are lower. We can get adequate levels to basically achieve the results we want. So lucky girls, they get to do it.
Right. And I've certainly known a lot of my friends and colleagues and people I meet who've tried the topicals. And males, basically, if you've thought about doing that or you've already tried it, you're not only wasting your money and time on that, as you just pointed out, it can actually be dangerous.
Right.
I've known of several males on that. First of all, it didn't work, but also the side effects. That DHT, if you want to lose all your hair, have an enlarged prostate, or have issues with that, then I guess you can go down that route, everyone. So be very careful of that. And the scary thing to me, Dr. I, and I know y'all do a lot of ongoing training all the time. You're always at conferences, you're at meetings, you have all this training you have to do all the time. It's continuous. In fact, Cenegenics is not only the largest age management practice in the world, but we also even train and certify physicians in the very specialty.
Yes.
Physicians come from all over the world to train and learn this specialty. So I know a lot of things go into y'all's training with this. But y'all, that's why y'all do the levels and all that. You know exactly what to check for. You know the different routes. You have 25,000 patients to use as case studies to know what works. And everyone, we've made this conclusion very solidly here after 25,000 patients. Males, the topicals are not a route for you.
That's right.
So definitely keep that in mind. Call us, talk to us. We can guide you through all that. Next question is pretty simple, straightforward question, everyone. Is, okay, I definitely need the help. I'm definitely experiencing all these common symptoms of aging. Yes, I get it about the metabolic and hormonal piece. How do I get started? Dr. I, how does one get started in the program?
James, it's simple to do. Give us a call. Once we have the opportunity to chat with you and understand the issues and problems, and in our mind determine our program will be the effective solution, it's a very simple process. We lay out the details of how you do it. I'll be happy to go through all of that with them. We can help, and the best part is it only takes a single phone call to do it. But again, we're going to spend some time with you even on that. So don't think you're going to call up and get a 1 minute a 1 minute response. We're actually going to spend the time necessary to make sure that A, you're a candidate for the program, and B, that the program will do the job.
Absolutely. So if you're a male or female, I don't care if you're in your upper 30s or in your 90s, if you've had any symptom we've talked about today, there is help for it, everyone. You do not have to get old. Yes, we all age, but you don't have to be an old person. And you don't have to lose your sharpness. You don't have to lose your cognitive ability. You don't have to lose all your energy. You don't have to settle for a body composition that I know when I think about old folks. I think about my grandfather when I was growing up. I think about how people aged back then. Medicine has advanced in so many ways in our lifetime. It's also advanced in age management medicine. You do not have to age like your parents and grandparents did. There's help. But we want to talk with you. Take a few minutes. It'll be the best call you've ever made. Pick up the phone, call us, the number that was provided. We're here to speak with you. Everyone, I do look forward to speaking with you. I know, Dr. I, you do as well.
Right.
And, the next step would be for you to just call.